Have you ever been told your blood test came back ANA positive and immediately you thought, do I have lupus or arthritis? Many RAs come to me worried, confused, and sometimes even scared when they see this result. But here is the truth. ANA positivity is common. It does not always mean a disease, and it's only a part of a bigger story. Today, let's unpack ANA in a simple term, clear the myths, and give you the hope. Before we dive in, make sure to hit that like, subscribe, and share button so more RAs can find clarity and strength in their journey. Hi all the RAs, this is Dr. Ananda Subedi, your rheumatoid arthritis coach at the Room Doc and the rheumatologist practicing at Empower Arthritis and Rheumatology Center here in Cary, North Carolina. With over 10 years of experience helping many patients with rheumatic conditions and rheumatoid arthritis, I want to be your guide to understanding these conditions. And I do understand ANA can feel like a scary label, but knowledge is power. Together, let's make more sense of this blood test. Now, let's start with the most important questions. What is ANA? ANA stands for anti-nuclear antibodies. Antibodies usually fight off infections. They are part of your defense system against infections. These antibodies kill bacteria, viruses, and even cancer. Think of them as your bodyguard, which is there to protect you in case of danger. But sometimes they mistakenly target the nucleus, the control center of your own cell. This is why ANA is often checked when doctors suspect an autoimmune condition based on your symptoms. In particular, when there are enough warning signs of these autoimmune conditions such as unusual skin rashes, arthritis, unexplained fevers for a long period of time. All of these symptoms could indicate there is a problem in your body. And autoimmune conditions are known to cause such type of symptoms. So your doctor typically think of ordering an ANA test. Let's think of ANA like a smoke detector. It's sensitive, very sensitive, and often goes off very commonly. But there is a problem with this smoke detector. Sometimes it could be a burnt toast, not a real fire at your home. Even with the burnt toast, this alarm goes off, causing some false alarm. Hence, it is very important to understand the background on why the alarm went off. Is it truly the house on fire or just a false alarm? ANA tells us there is something activating the immune system, but not always a disease. There is a big difference here. Disease versus the false alarm. Now, to better understand ANA positive, let's quickly go over what causes a positive ANA. There are many reasons ANA can be positive, such as the most common being autoimmune diseases. There are so many autoimmune diseases that is prevalent. Some of the common ones that can cause positive ANA includes obviously lupus. There's other condition called Sjogren's syndrome, inflammation in the muscle, which is also called inflammatory muscle disease, and some form of arthritis can even cause positive ANA, such as rheumatoid arthritis. So the second most common condition that can cause positive ANA include infections, such as viral infection like hepatitis or even common cold. They can temporarily cause positive ANA. Hence, as we go back on the earlier discussion, it could be a false alarm, not always lupus. The third most common cause for positive ANA is medication. There are some common blood pressure medication that can cause positive ANA. Antibiotics can sometimes also cause positive ANA. When the positive ANA is due to these medications, it's always important to go over your list of the medication if any of them are known to cause positive ANA. Your primary doctor, your rheumatologist might be able to help you whether your positive ANA is due to these medications. Now, in rare instances, these medications can also cause lupus, which we call drug-induced lupus. In that case, you will have much more symptoms of lupus along with the positive ANA. Now, you might be surprised to know that even the autoimmune thyroid condition can also cause positive ANA. You might have heard Hashimoto thyroiditis, which is an autoimmune thyroid disease that can cause positive ANA without having lupus. And even interesting, cancers can sometimes even cause positive ANA. This might be a signal that your body is trying to fight off the cancer. That's why we might sometimes see positive ANA in patients who have cancer. And the most surprising, and many of my patients get surprised when they hear this, a lot of the healthy individuals can also have positive ANA. Now, depending on your age and depending on the ANA level, are also called titer, up to 15% of the perfectly healthy people could have a positive ANA. So keep that in mind if you have that positive ANA test. Please don't jump to the conclusion that you have lupus. It's important to go over that list of the things that can cause positive ANA, including autoimmune diseases, medication, autoimmune thyroid disease, cancer, and even healthy people. So just be mindful. So the key to finding what truly is causing your ANA is understanding your overall symptoms, your other medical history, your medication list, and many other tools that doctors have. Hence, before we jump to the conclusion, we need more information and more data to better understand what is truly causing your ANA positive. That will also help us guide whether the ANA is a true alarm versus a false alarm. The more data will tell us if this is truly a house on fire versus a burned toast. Now, let me tell you a story about a positive ANA in my clinic. I have a patient who is in her 40s, came to me in tears after her primary care doctor said her ANA was positive. Now, you can imagine, she feared this was lupus. But after we reviewed her history, a thorough examination, and then reviewed all of her blood test results, we realized she had no symptoms of autoimmune disease. Her other blood tests did not suggest any signs of autoimmune problems. And we realized that her ANA was just a false alarm. And then she left our clinic feeling more lighter and happier, knowing that she does not have lupus. So many of you might be in the same boat. So always talk to your doctor, talk to your primary care doctor and your rheumatologist so that you know this could be a false alarm. Now, all of you who are watching this video, have you ever had a test results scare you more than the actual symptoms of the problem? Share those in the comments below so that other people can understand more and learn from you. Now, so far we have discussed the ANA could be a true positive due to those autoimmune condition or other medical conditions, but it could be a false alarm, a false positive ANA test. Now, you might wonder, what does that mean? Why do I have that false positive test? Now, here is the key. ANA is a very sensitive test, but is not a specific test. That means it often picks up positives when nothing is wrong. So you can think of it as a false alarm. But we also need to go over the other list of conditions that can cause positive ANA. As we discussed earlier, up to 15% of healthy people and nearly 30% of older adults may test positive ANA. Even at higher level or even at higher titer, more than half could still be falsely positive. And the other problem is the cutoff in different labs. Different labs have their own technology of doing the ANA. And ANA could be done with different technologies, which can cause variation in your ANA testing. So always ask the question, is it truly positive? Is it a variation or is it just a false alarm? So context is everything. ANA blood test itself alone never makes a diagnosis. In my practice, I have seen the stress of ANA causing flare in a lot of my rheumatoid arthritis patients. Many RAs, they lose sleep, fearing the worst. Stress itself can worsen inflammation, fatigue, and pain. This is why I always remind my patients, your diagnosis is not decided by a blood test. This ties back to the NEST framework: nutrition, exercise, sleep, and stress. So always make sure you have tools to manage those stress so that you don't have those RA flares due to this false alarm. Now, here is a spoiler alert. There are rare type of autoimmune diseases which we call Rupus, which is a combination of rheumatoid arthritis and lupus, where you have symptoms of both diseases. Rupus will have a positive ANA and the RA markers positive along with findings of lupus, more than just arthritis. So always be careful. We are not labeling your true ANA as a false alarm. So your rheumatologist like me will do further testing. They do go over all the history and physical examination to better understand whether your ANA is truly due to an autoimmune disease like lupus. Now, let's go back on our earlier discussion regarding ANA and what is its role in different forms of arthritis. typically rheumatoid arthritis. The overall prevalence of positive ANA in rheumatoid arthritis patients varies significantly across different published studies, ranging from approximately 15% up to even 70%. So you can imagine there's a lot of variation on how many patients with RA will have positive ANA. But the key is ANA is not the main test for rheumatoid arthritis. We rely more on other rheumatoid arthritis specific blood tests such as rheumatoid factor, anti-CCP, and other tools such as joint ultrasound and other tools that can make the right diagnosis of rheumatoid arthritis. And sometimes ANA positive RAers may have a slightly different disease course, but it does not define your future. Now, in particular, there's a pattern of ANA called nuclear pattern, which you can see in your lab results, which is independently associated with lung complication, particularly the interstitial lung disease. So if you have ANA positive and this particular pattern called nuclear pattern, we need to monitor your lung symptoms a little more closely to make sure you are not developing the complication of rheumatoid arthritis called interstitial lung disease. Now, let me ask a quick question to my RAers. Have you been tested ANA positive? Did it change your journey of your rheumatoid arthritis, or is it just because of confusion? Please share your comments below so that our other community members can also benefit from your response. Now, let me quickly recap what we talked today. We went deeper into the mysterious test, the ANA test, and we discussed about what it means by positive ANA test. But the bottom line, what we talked today is ANA positive doesn't always mean a disease. It can show up in autoimmune conditions like thyroid disease, infections, and even medications. Or even healthy people could have positive ANA. False positive ANA are very common. And while ANA can play a role in arthritis evaluation, especially RA and lupus, it is never the whole picture. You always need to consult with your primary care doctor, your rheumatologist, to get a better picture whether the ANA is truly a problem in your health. Now, here are the 3 takeaways from this video. Number 1, don't panic if you have a positive ANA test. Always ask that question. Do I have the symptoms of an autoimmune disease like lupus? Before jumping into the conclusion, remember, it might be a burnt toast, not a house on fire. Number 2, strengthen your nest. Nutrition, exercise, sleep, and stress management. Don't stress over the positive ANA, which might cause RA flares. Always talk to your doctors. The third one, lean to your 4F, the faith, family, friend, and fulfillment. This is your fuel to overcome your stress. If you have a positive ANA, to minimize your stress, call your doctor to make sure they will be referring you to a rheumatologist to understand better whether you truly have an autoimmune condition. Now, all of you RAers, you are not alone. Together, we can move from pain to possibilities. If this video brought you clarity, please like, subscribe, and share it with someone who may be worried about their positive ANA test. And please don't forget, your health is more than just a lab test. It's about hope, healing, and living fully. See you on the next video. Take care. Stay strong. Bye-bye.